Welcome back to The Fit Life, the podcast where we unpack what it really takes to live a healthier, more balanced life. Today, we're shifting the focus from elite performance to something we all need help with, taking better care of ourselves from within. We're joined by Dr. Ed Cody, a family medicine consultant from Mediclinic Parkview Hospital, to talk about the basics that often get overlooked and how to feel your best without overcomplicating it. Dr. Ed Cody is a UK trained consultant with over 15 years of experience in family medicine, from mental health to men's health to ENT issues, skin conditions, chronic disease management. He's seen it all. He's here today to help us understand how small, everyday decisions from sleeping, movement, nutrition, and stress can have a big impact on our overall well-being. Dr. Ed, you're very welcome to the podcast.
Owen, thank you so much for having me here today. My first ever podcast, and for that really glamorous title that you've given me. I'm a family medicine consultant, but for those of us from UK, Ireland, the Western world, you will know me as a GP. So I'm really just a jack of all trades, and I spend most of my day talking to people, making a little bit of impact in people's lives, hopefully.
Important to talk to the people. I think a lot of people are, they go into a doctor and it's very clinical sometimes, trying to create that relationship with people.
Do you know what? You find that all the time. First of all, you come in, it's stressful getting car parking. There's never enough car parking in hospitals. I don't know why this is. It's stressful at the admin desk. We sit you down straight away. We put a blood pressure cuff around your arm, and you always find that people's blood pressures are through the roof. And I think it's my job then is just to talk to people. I just love having 5 minutes of absolute small talk,
of course.
and then actually getting down to business and finding out what's actually wrong with you during that time. As my job is to make people feel a bit more comfortable, I think.
What do you think is the biggest health mistake people are making right now?
Oh, geez, we're starting with the negatives. I'm very much a half glass full kind of guy.
What positives? So we'll come back to the negative.
Well, let's do the negative to start with. We'll get it out of the way, I suppose. I see loads of people every day. The most common thread, I think, which goes through a lot of my consultations is that people maybe get the balance in life a little bit wrong, in particular in this region. There's so many people come in to me with lethargy or headaches or tummy pains or anything like that. We go through the history, we do a bit of an examination on them, maybe do some tests, and everything comes back generally okay-ish. And then you scratch the surface a bit more, and yet you realize, why are they like this? And you tell me a little bit more about your life, and then you realize actually they're working all hours of the day, or there's family pressures at home, or they've 4 kids and they're trying to juggle being a mum or a dad and a full-time job as well too. And this is, I think a lot of people are low-grade burnt out without even realizing they're low-grade burnt out, and they're not spending enough time on self-care. They're spending a little bit of time by themselves in the gym. They're not eating the right things. They're not concentrating on their sleep and their general wellness. I think that's probably the biggest mistake I see in people.
Absolutely, and I think if you look at everything we're looking at, you're taught to go hard. It's like, you need to go hard. And like, as a business owner, I know that only too well. It's like, you need to go hard. But if you stay doing that, you're going to burn out.
Totally. Dubai is a pressure cooker. We're all here. We're all working, really hard. We're all under pressure all the time. We're all available all the time as well too. Like, how many times do you get a WhatsApp at like 11 o'clock at night and you think, actually, this isn't really right, but you still have to reply to it because you just won't be able to switch off unless you do that as well too. So yeah, we're all going at 100% all the time, and just trying to learn to set those boundaries and switch off a little bit, I think is one of the...
Do you think that trend is changing now? Do you think people are more aware of their self needs, let's say, of what they need to do to relax?
I think there is some awareness, and I think a lot of big corporations and stuff have this wellness buzzword. However, I think whenever it comes down to the nitty gritty, we can all say the buzzwords, we can all do the wellness events and stuff because it's easy to put this, but whenever it comes to practice, it doesn't always translate that way as well too. I think
It's hard to change habit too.
oh my God, yeah,
You're used to doing this for 10, 15 years, and it's really hard to suddenly say, "Do you know what, I'm going to work a lot less."
yeah. Like I don't know about you, but I must say I thrive on working hard as well too, and I get a real buzz out of it, and I just have to be careful about kind of looking after myself as
Yeah,
well too
of
in the
course.
past, and I haven't always got it right along the way.
No, and I think it's always a balance, isn't it? It's always trying to find that balance,
Totally.
because your work does, for me, also it gives you purpose. It gives you purpose in your professional life. Hopefully, it doesn't give you purpose in your personal life, but
Well,
it does help. But in terms of what you enjoy doing, your passion, I think if you're not passionate about it and you're not purposeful about it, that's going to hurt you too. If you're working 6 hours a day on something you hate, that's 10 times worse than working 12 hours a day on something you love.
so true, yeah, as well too, yeah. And it is all about like having these escapes, as well too. Like for me, kind of a hard line is like I will always try to get out of work almost on time-ish, and then go home, and we have a 3-year-old daughter, and it's very important for me to do bath and bedtime with her as well too. And it's just
Yeah.
it's the whole world could be coming down around you, but one of the most important things for me is looking at this crappy painting that she did in school that day and thinking, wow, that's actually amazing. Those are the important things
Absolutely.
to me.
I think I have a young family as well. It's very grounding. Kind of
Yeah.
like you're like, oh, what happened today? It doesn't really matter, in the overall scheme of things. Maybe if he was a doctor.
Well, yeah. Well, family medicine doctor.
Yeah,
I'm
yeah.
very good at writing sick leave certificates,
But
but
it is a good grounding. It brings you back down. We'll bring it towards the food side a small bit.
yeah.
For us in Fit Meals, it's hard sometimes. We don't offer every plan, let's say, like we don't do keto, for example. These kind of things, we get so many people looking for all these different fads, different diets. What's your view on the trends of diets, let's say, in like low carb, keto, fasting? Obviously there's positive and negatives. What's your overall thoughts, and what's the trends you think?
Well, in my job, I treat people generally, okay? Like obviously if we're speaking to an ultra high performance athlete, then their diet requirements might be slightly different from most of us who have a job and family, and we are just trying to stay healthy, maybe with a little bit of performance in there as well too. Whenever I'm giving people dietary and lifestyle advice, what I generally say is we're not dealing in weeks to months, we're dealing in months to years to the rest of our lives. And whatever changes you make, they have to be sustainable. So like any of us can go on a fad diet, okay? We can eat lettuce and drink water only for 2 months, and we'll lose a lot of weight, and we'll make our numbers and the lab tests look much, much, much better. But if you hate it, you're not going to be able to stick to it as well too. So what I'm all about is trying to encourage the small changes the practical changes that we can all do in our lives to make significant impacts, and we can keep on doing these throughout the years. And the things that we do in our 20s and 30s and 40s, then we reap the benefits from in our 50s, 60s and 70s.
Absolutely.
as well too.
It's all about the longevity of it.
Totally, yeah.
Creating it.
Like, and that's just where I suppose we talk about, like, it depends on people's character types as well too. My ethos is mostly about moderation as well too. So I think, behave yourself 80% of the time,
Absolutely, yeah.
but still have the treats, because we have to do this. What's the point in living till we're 160 years old if we're miserable all the way along it? If you want to have that pizza, have that pizza, but just don't do it every single day.
Absolutely. I'd be 80-20 principle. If I can get 80% of the week right, the 20 is going to look after itself.
Exactly. Obviously it's different if you're training towards something. Yeah, exactly. Yeah, and then in which case, get the weighing scales out and count absolutely every gram of carb or whatever you're putting into your body. But
putting food into our body, what do you feel is the relationship and the understanding of the relationship now between our food intake and chronic disease?
I think it's so important, like what you fuel your body with impacts so many different areas in life, as well too. Um, I suppose the one we all know about is calories and weight management as well too. So if you eat lots and lots and lots of calories, lots of fat, and you're not using all that energy that is given you, yes, you will generate more fat tissue, which then impacts on your cardiovascular health, your metabolic health, your diabetes, and there's lots of other kinds of illnesses associated with carrying too much weight. And we wear out our joints quicker if you're carrying an extra 20 kg. Certain types of cancers and things like that are associated with carrying too much weight as well too. But there's also other things, in your diet as well too, like your vitamins, your mineral intake as well. If you have very salty food, for example, puts up your blood pressure. There's other foods which I'm not going to go into too many details about, but like you hear about all these, aspartame in your Diet Cokes and whatever, that all these things are not good for you. And again, my kind of thoughts are in moderation, as well too. Like if you want to have a Diet Coke of a Saturday afternoon, have a Diet Coke on a Saturday afternoon, but just don't be drinking 6 cans a day.
It's not for breakfast.
I remember having a patient at one stage, he came in to me, he said he drinks 40 cans of Coke a day.
What?
I know. I was like, what?
Is that even possible?
I was like, what color is your pee? I was expecting it to be brown. He had bigger psychological issues, but I was like, wow, this is massive. So unhealthy.
And obviously, it's the chicken and the egg syndrome. Does the psychological issue cause that food addiction? But there are foods that are causing psychological issues as well in anxiety.
Well, definitely, yeah. And well, it's, as you say, it is chicken and egg, because I think there is so much psychology associated with our food habits as well, too, and whenever you eat something you really like, you get a bit of a dopamine hit, and this is where a lot of these kind of fast food chains and stuff, they're really focusing on that, and then human behavior is simple to interpret. We thrive off this dopamine hit, and we want more and more and more of that. But then as you get too much dopamine, too much of anything is generally not a good thing.
Yeah, absolutely. So. Especially I think as I get older, if I eat something that's not good for me, it definitely affects my mood.
Oh, definitely. Yeah. If anything else, just, the guilt you have afterwards as well, too. You're like, oh, I shouldn't have done that. I've undone all my good work for the week. But, I suppose whenever you get things in balance, then you don't feel that guilt.
No, absolutely.
You've like, actually, do you know what? I've worked hard for the week.
I've had a good week.
I've had a good week. I'm all right. I can have a burger. Why not?
Exactly. Yeah. Do you see many clients having sleep issues because of their food intake?
Yeah. Again, I think it's part of the bigger picture as well too. Like a lot of it's additives which are in food. It's all the MSG, it's all the caffeine and salt intake as well too. So it does affect everything in life. And sleep is so important towards our recovery and our well-being as well too.
Absolutely. A thing I see a lot now is obviously it's going on a long time, but definitely a lot more of my friends are doing a lot more fasting, especially before going to bed. If you have a big meal before you go to sleep, that's going to cause havoc with your sleep patterns. We're all wearing wearables now. You wake up in the morning and it's like, what caused that? Why am I only
80% sleep, 80% sleep last night? I'm not sure because my daughter came in to me at 5:30 this morning, which I wasn't particularly impressed about. But
could have an impact.
Yeah, exactly. Yeah.
I do feel that if I eat certain foods, I actually know that my sleep is going to be affected.
Oh, massive.
And it could be individual to me. My wife might eat something, she might be fine, but I'll know that's going to impact me. Is there a reason why we feel that as we get older? Is it just we're learning? Is it taking us that long to learn that?
I'm not sure there's a scientific reason behind that one. Like I've found my body adjusting a lot. I'm 39 years old, believe it or not, and I've in the last 5 years, I've really noticed that there is trends in my body. Similar to yourself. If I have uh, a takeout which is very brightly coloured, and I know there's a lot of kind
Yeah.
of preservatives in that, or I just find I do not sleep well at night. I don't get a restful night's sleep as well too, and I find the salt in foods as well too. If I eat anything salty past kind of 4 o'clock in the afternoon, then I just know I'm going to be up in the middle of the night at the water fountain,
Yeah.
as well too, and then consequently you have to pee more. And it's just not a healthy way to be.
It is a tough one, all the amount of information out there, because it is overwhelming. If you were to give one person, or if you give a person one simple food habit to take in, and that would be a longevity one, what would it be?
One simple food habit. Oh my goodness, that's a tricky one.
It has to be easy, otherwise no one's going to do it.
We'll go for something really, really simple.
Yeah.
Okay, replace full fat milk with semi-skim milk.
Yeah.
Okay, like that's simple. It helps your cholesterol. Sorry,
Absolutely.
it's not very exciting, but it's for me anyway. It would be easy to do. Because I don't know there's any difference in taste between it. So
Yeah, likewise. It's probably it's probably a
it's a
mental
chill
thing. Is
yeah, you're used to going to the blue milk in the fridge.
just paint it.
Yeah, why not just why not go for the red one instead? Yeah.
Do you often come across patients who think they're fit, think they're healthy, and you're like, sorry, you did this isn't adding up, or something's not adding up, or they actually look fit, they look healthy, and you're like, wait a minute.
Do you know, I had this recently, actually. I had two guys who were doing ultra marathons.
Yeah,
Okay,
yeah.
so like they are the peak of their physical fitness. They both came in to me for health checks, and they both came in within a week. And actually, I thought the labs were wrong at this stage, because they both, whenever we ran their HbA1c, which is a 3-month average blood sugar, they both came in the pre-diabetic range, even though there was not a pick of fat on them.
Yeah.
They were, very, very active, very high performing. And what I think was showing up here was just the amount of fuel that they have to put into their body, that their body was actually struggling to process this as well too. And I think I had this conversation with him. I spoke to Dr. Alan Curry, who's one of our sports med doctors, about this as well too, and we're actually planning on doing a little bit of a study around it.
Right.
But I suppose my consultation with these patients afterwards, it went along the lines of, like, there is a little bit of strain on the system here, and say you weren't using all these calories as part of your exercise regime, then you certainly probably would be in difficulties, due to their genetic makeup and how they process sugars and fats in their body as well too. But it was interesting just seeing, 'cause I was expecting them to have a clean bill of health.
Absolutely.
And then I was like, how do I tell these people actually this blood test shows possible, like, kind of pre-diabetes? Now, it was only a one-off blood test. We don't make a diagnosis based on that. I said, look, come back and see me in a few months' time, but maybe just have a look to see what you're actually putting into your body, to see whether it is very, like, they will need the calories, but maybe adjust the diet a bit to make sure that the calories are good calories.
So is it a case that they're putting so much food into their body that the body is struggling to get through it all, or it's just like, again, it might be individual, that it's a certain type of food that this guy is eating that might not be the right type of food for
I
him?
think it's both. I actually do think it is both. Like, I think, like, they're putting their body under very unnatural demands as well too. Like, we're not meant to expel that many calories, but it is these people love, the sports that they do, and I'm never going to say don't do it, because it is generally good for them. But you can just see there was a little bit of strain on the system there, just with the calorie intake that they were having, and then the organs which process all that nutritional.
It's good you said the word unnatural, and I think that goes back into moderation. If something's unnatural, it's going to create an imbalance somewhere. No more so than if we eat unnatural foods. let's say processed foods or things like that, if they're unnatural, you're going to pay for it at some point along the line.
Massively, yeah. Like we are, you know, our diet and our lifestyles that we are living now are unrecognizable to our ancestors, say 150 years ago. You know, the foods that we eat, I would say if we gave a high calorie takeout meal to one of our ancestors, 150 years ago, they would have horrific gastrointestinal symptoms as a result of it, because it would be such a shock to their system.
Yeah.
And we've kind of grown to adapt to be able to take these in, and humans we're evolving, but we're not evolving quick enough to keep up with the changes in our diet and our lifestyles at the moment.
Do you see patients become more aware of ultra processed foods?
Very much so. Very much so. There's so much, like, whatever is on social media will come into me, in a week or two's time. At the moment, I'm getting lots of what's on social media at the moment about testosterone, because I've had so many guys coming in wanting their testosterone checked as well too. Yeah. So yeah, no, like there is such an awareness of this ultra processed foods at the moment, and we are like, this is something. You said, what are patients doing wrong? Was your first question. And actually, I think, what are patients doing right? Okay. I think it is really, really nice to see these people who have an awareness over their health now because of these fitness influencers, lifestyle influencers as well too. Making positive changes in their diet and their exercise as well too. And yeah, we are what we eat.
Yeah, absolutely. I think it's difficult sometimes because I think a lot of times we think we're doing the right thing, and it's very cleverly packaged. It's hard to see these processed foods sometimes. You have natural written on a lot of these foods sometimes. They're far from natural.
Oh, exactly. Yeah, you have a picture of a farmyard scene on this, and you think, oh, well, this must be good. Yeah, it's all about branding, isn't it? As well too. So, yeah, it's it is really, really difficult because supermarkets and food chains, they are smart. They work on our psychology. They work on our weaknesses as well too. And this is where, if we can build up the healthy habits, the routines, and stick to good quality food, is so important. And something else to think about as well too is pricing of food as well too. Like you go into a supermarket and you see chicken breasts at one price and you see them at the other price, and you think, actually, I'm going to go for the cheaper ones. And then actually, if you look at the fine print, you say, oh, it's maybe pumped full of hormones or whatever, and you think, well, actually, what am I putting into my body? And I know me as a dad as well too. Like for me, I would probably be happy enough with the cheaper one. Well, I wouldn't be happy enough, but I would.
For yourself.
But whenever it comes to my child, it's a line I would never cross as well too.
Yeah, my wife buys the organic chicken breast for our children, but we eat the other chicken breast.
And it shouldn't be like that. I know it's maybe something we need to look at ourselves as well.
I do that too, not just my wife. She will.
I will be my.
We'll edit that out. In kids, processed foods, it's a nightmare. Again, parents are getting so led down a road of this is good for your child. Organic. You can have organic and processed foods on the naming, and it is so misleading.
Oh my goodness, yeah, absolutely. And then you think of all the other stuff they put into these foods as well too, and then you also have the pressures of whenever you drive past a McDonald's, everyone wants their chicken McNuggets as well too, and you have to say no, and it's very hard to be the bad guy about this as well too, isn't it?
And it's not elimination, that's impossible.
Oh yeah, totally, yeah.
Totally
and it's about moderation.
Yeah. I'll be the first to. There are some days you need to grab something quickly, feed your children, but as long as you're not doing it every day of the week, I think that's the issue.
I am by no means perfect myself, and I will I'll never be one of those really, really preachy doctors who says absolutely you have to cut out all the things that you enjoy and
McDonald's today.
yeah, exactly. Yeah, exactly. So like we all have our vices. Like for me, come a Friday evening, I love a pint. Okay, and I will never say don't drink. I'll say drink within moderation. Those kind of things. So it's just how I practice medicine is how I live my own life as well too.
It's
And
relatable.
yeah, well that's it. I think. If someone came into me and we checked their cholesterol and they had a really, really high cholesterol, and I shouted at them and said, like, you have to stop eating everything, they're not going to come back to me. They're going to put their head in the sand, So how I generally go about this consultation is say, look, we have the option of medications, but if you can make these lifestyle changes, watching what you're eating, whenever it comes to diet and exercise, I always think of a ratio of about 70-30, so your diet is actually considerably more important,
Is it really because your diet is one way, it's nearly invisible. The food goes into you. You don't, you don't see what it does. You don't. Is it really hard to get people to change their mindset when you say to someone, listen, your cholesterol is really high. We're going to have to make some changes here. How hard is it to get through to them? You are going to have to make changes here.
Yeah. Well, I turn the monitor around at that stage and I show them the actual figures as well too. And we have all these risk assessment tools to work out what your 10-year risk of having a heart attack or stroke is as well too. And you give them these figures. Now, I never want to scare the bejesus out of a patient because I don't think it's right. It's just not me. Okay. Now, for some doctors, they will do that. I want to more encourage patients, and I say, look, I give them my own examples, of what I do. I say, look, let's try to make some simple changes, and then we'll recheck things in a few months' time as well too, because I just worry if I was like one of those really, really, really preachy doctors and was unrelatable, then the patient's going to go out of the consultation room dejected and think, actually, I'm not going to be able to do it. It seems like such a mountain to climb, and I think there's a higher risk of failure at that stage. Because the last thing I want to do is for someone just to stick their head in the sand and ignore the matter. And I always say, look, I'm asking you to do a lot. I want you to come back in to see me. Set a reminder on your phone to come back in and see me in a few months' time, even if you haven't been successful in making these changes. Okay, come back in, come for the chat. We'll do a further encouragement. Eventually, we will make progress as well too. But
you need to bring them on the journey. No one likes being told what to do.
Oh yeah,
and especially as we get older, we like it even less. So it's trying to align people with that mentality, trying to get them on side rather than
100%. You're working with them. You're not working against them as well too. Like I was at a conference at the weekend, and there was someone we would all relate to. A 40-year-old guy with borderline high cholesterol, borderline high blood pressure, and the chat was he needs to go on to medication straight away. And I said, look, if that was any of my patients, I said you need to go on to medication straight away. They will not be keen on the idea of this, and if you're that far apart, with your kind of treatment goals, you're not going to be successful, as well too. So always chat to the patient, get them on board with your ideas and your way of thinking.
Do you think it's hard for people to see the change they have to make too until it's evident, until there's actually a physical change?
Yeah. I suppose what we're dealing with here is cholesterols and blood pressures and things like that, which you don't have any symptoms of until things go drastically wrong as well too. Whenever it comes to weight loss, whenever you start to lose weight, you feel great about yourself. You're happy when you see yourself in the mirror, and whenever you see the numbers go the right way as well too. And I think that can really be helpful. And then you start to notice the snowball effect. Things happen pretty quickly at that stage.
Do you ever see like chronic anxiety or burnout impacting people physically?
Oh, all the time. I always tell the story about me.
Yeah.
Okay, so I came to Dubai 2 years ago. I was a partner in the biggest practice in the country. I was working far too hard. I was doing 2 night shifts a week in the out of hours GP because we didn't have enough money at that stage. And I was 106 kg at that stage. So I'm now 81.
Wow.
And my blood pressure was very high. And I just look at pictures of myself at that stage and it was horrible. Now, no injectable weight loss meds were used. Okay, I believe it or not, yeah. But no, we had a conversation. I was sitting in my consultation room at this stage. I goes, is this me day in, day out until I have a stroke in my 50s and live a really unhealthy life? Or, I just wanted to make a massive change, for myself, for my family, and also because I didn't want to be like a hypocritical doctor, saying you should be doing this and this and this. But I was a big fatty behind the desk as well too. So, so we made a massive change. Myself and my wife, we changed our diet and our exercise regime, and we did it together as well too, which was so supportive. If you're trying to make, if you're kind of trying to diet and then you see your wife having a big lasagna next to you, it's pretty difficult, as well too. But whenever you do it together, it was really easy. And I go to the gym every morning before work. It helps my mental well-being. It helps me cope with the demands of the day. I drink a lot less now as well too, and I just really enjoy looking at.
I would say I drink a lot. I've upped my drinking intake.
A lot less. That might be something we need to edit as well too. So.
And did you have a child at that time as well?
Just had a young baby. Yeah. So, and I think there is.
Did your why change? Did your why you were doing it?
I bet, yeah, definitely. I think, as parents, your bodies change a lot around the time of having kids. Obviously the physical changes in women are very, very evident. But you do see that the dad bod is a thing. As well too, because suddenly your responsibilities change. And you might feel you have to work more. You have to be around. You spend more time with. Not on yourself as well too. So a lot of people do gain weight around this time, and it's important, to actually zoom out and look at your bigger responsibilities. Your bigger responsibilities are your health, because you have to be around here for this thing which is screaming a lot.
Trying to manage your time as well, because I think pre and post kids time, you have to be military like, and if work is coming up, saying the first thing you're going to take time off is yourself. First thing, because your kid needs you. That's number one. Your wife, your work. You need time to eat, to sleep. The last thing in there, and you're going to absolutely push it as far away as possible, is yourself. When you take time for yourself, when you take time for the gym, all those type of things.
Yeah, whenever they say on the plane, whenever the oxygen masks drop from above, that you should put yourself first and then do other people's. Do we ever do that as parents? We don't. We always put our kids first, and we spend all the time with them. We give them the best food, the best nutrition, and then whenever it comes to yourself after you've done bedtime, you don't have 15 minutes to cook yourself something decent, or you don't have that hour to go to the gym, or even go for a walk just for your own kind of.
You should get a meal plan, Ed.
I don't know. Does anyone know where you can get one of those from?
I know a guy.
Yeah, well, but you see, that's actually something I think is really good about these meal plans as well too. We all live hectic lives, but if you have a meal plan, then you're not going to be spending all night cooking or shopping, or you can actually spend the time spending quality time with your family, but also making sure you're putting the right things into your body as well too. And that, I think, it just really aligns with the hectic lives that we all live these days.
Yeah, absolutely. For me, one of the biggest things for me in fit meals is I don't have decision fatigue. I don't have to think about cooking. I don't have to think about my nutrition. I don't have to think about time it takes to cook. I don't have to think about shopping. I don't. All those things are literally gone for me. I get it delivered in to the door. Obviously, I'm self-promoting now, but
No, no, but
meal plans in general. I just think it takes a lot, especially with young kids. You know, that's a half an hour I can spend now with my two sons instead of trying to get stuff together for food or things like that.
yeah, exactly. Yeah, come 7 o'clock at night, and then you think, oh, what am I going to have for dinner? And then you have to go to the shop, and then you go to the local shop, and you realize,
Online.
yeah, everything, yeah, and you're paying more for it, or you just you know, you can't ascertain the quality of what you're getting at that time of the day, you know, as well too. So.
Absolutely. What would be the top things in your shopping list? Getting very personal, food wise.
Oh, so I didn't realize that before you do a podcast, you get a list of the questions or topics. And I was reading down, I was like, oh no, this question. And at this time, I had, like, it's confession time, okay? Like,
Yeah.
my diet is not amazing, okay? Like, some people who know me will know that, you know, I was a big fan of beige food for a long time. My mum was not hard enough on me with my fruit and my vegetables. So I'm getting better. I really, really am getting better at kind of fruit and vegetables. Shopping list, right? Coffee number one. Okay. I've only started drinking coffee in the last year and a half as well too, and
Really?
I love the stuff now.
Yeah.
Yes, fruit and vegetables, mushrooms. Rice, pasta, breads, those kind of things.
The usual, the staples.
It's the staples. Yeah, nothing too exciting in there.
Have you found yourself eating more fruit and veg since your child came along?
Yes, definitely. Actually, more so because we always just have stuff in the fridge
Same.
for her as well.
Yeah. We're feeding it so much to them. I'm like, well, I'll eat that too.
Yeah.
It should be, you know.
I still should eat more. Okay.
Exactly. Yeah.
My wife, if she ever listens to this podcast, hopefully she won't get this far in. She'll be like, "What is she talking about?" Yeah, but we do our best. Yeah. So,
how important do you think our gut health is, or do you think of that much as a family protection? I know you have to think of the overall picture is in our mentality, anxiety, mental issues even that we have are being caused by food and our relationship between our gut and our mind.
right. Interesting one. Serotonin. Have you heard of serotonin? Serotonin is like our happiness hormone. Okay.
Sorry, serotonin.
Serotonin. Yeah. It's a Nordy accent.
Yeah.
So serotonin is a happiness hormone. It's how our antidepressants that they hack into the serotonin. They're called SSRI, selective serotonin reuptake inhibitors. Where do you think serotonin's made?
The gut.
Oh, you're not meant to say that.
And my left hand.
We can edit that bit out as well too. No, yeah. So 95% of your serotonin is made in your gut. Now, I was blindsided by this recently. I automatically assumed it was made by your brain as well too.
Yeah. And I know that because I've researched and things like that. But most people probably will think your all of that comes from your brain.
Yeah, exactly. So our gut is so important whenever it comes to kind of serotonin production, cortisol production as well too, and there's so much research going on at the moment about gut microbiomes, all the good bacteria, bad bacteria, and trying to get things in balance as well too, and. You know, we each have individual kind of gut floras as well too, and this impacts on, you know, what medication might work for one person, which won't work for another, or what food groups will work for someone, and they mightn't be as effective as others, you know, in kind of calorie. Nutritional.
Do you see a lot of people looking for that? I see a lot now, people looking for, you know, when we say personalized nutrition, like individualized personalized nutrition, where like what is good for your gut as you as an individual, you know, getting your blood tests, maybe your genetic tests, things like that.
Yeah, yeah, you do notice that quite a lot. And we have started doing gut microbiome testing and stuff like that now as well too. Now, I have to admit, as a family medicine
Yeah,
doctor,
yeah.
I'm not specialised in this area, and I will generally direct patients towards the kind of functional medicine doctors to get this done.
Yeah, of course.
But it is a really interesting development in medicine, and personalized lifestyle medicine is really, 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 it's going to be the next big thing over the next 10, 15 years,
Agreed.
because
Yeah.
we're learning about genetic makeup and how potentially, like, for example, a lot of people will be very receptive to the painkiller codeine,
Hmm.
whereas some people can take huge amounts of codeine, but they won't have any effect on their pain relief as well too. So this is all
Yeah, and the same
work
is
in
true
progress.
with food.
Oh my God, yeah, totally,
Some
yeah.
people can have a huge reception to one type of food, and another person can have a very negative reception to it.
But sure, we've even known this for years.
Yeah,
Like I think of things like lactose
of course.
tolerance and,
Yeah, yeah.
and things like that. That's on a very broad, kind of broad kind of explanation of it. But that there is
Even when, let's say, we get that sort of information, go, I say to Ed, what was on your grocery? Mushrooms. Mushrooms are not good for you. You can't eat any more mushrooms, Ed. I'm very sorry. How do you think people will take that? Like, because we're already getting into a state where we're going, listen, you should be doing this, you shouldn't be doing that. And now we're going to say, actually, you can't eat mushrooms, your wife can, your daughter can't, how do we think the uptake will be on that as a human trying to have it?
I think whenever you change anything dramatically like that, you try to change a habit based on that one sentence. If I was told not allowed mushrooms anymore, I'd be like, no, I'm not listening to him.
Yeah.
I'd be like, what? Why? And then you might affect a little bit of change. I might cut down a bit, but I will still, if it's something I know and I love, then, and I haven't been given, a very, very, very hardcore reason why I shouldn't be by eating them, I'll still go back to them.
Yeah,
And that's human nature,
of
I
course.
think.
And I think it goes back to the thing again of moderation. Balance.
Harm
Do not have
harm
mushrooms for
reduction.
breakfast, lunch, and dinner.
Yeah, exactly. Yeah, harm reduction.
Yeah.
I think, and everything in balance. Again, it comes back to the fact that we don't want to live until we're 160 years old, because we have to live life as well too. It's about the journey.
One thing I see in I think Ireland is I think it's the lowest case of fiber intake. I think we're very poor in it. Do you see that in people over here, let's say? And I heard a sentence the other day that protein is out, fiber is in. And proteins are big. You need to get protein in your diet, which obviously we do. We're not getting enough fiber in our diet as well. Do you see that affecting any?
Yeah. Like, this is something we've all been taught all along, is that none of us generally will have enough fiber in our diet, and our gut has kind of become used to not having enough fiber in our diet, and apologies, but I spend most of my day talking about poo.
Yeah.
Like, we've got used to being a one a day kind of society, whereas actually naturally we're probably meant to be a 3 or a 4 a day. If you look at what we as humans were probably meant to eat, going back
Of course,
hundreds of thousands of years as well too. You do notice that there are health complications from not eating enough fiber as well too. The big one in our gut is a thing called diverticulosis. This is where you have slow transit through your bowel and slightly increased pressure in the bowels, and you get these little like outpouchings in the wall of the bowel, which can, if they're there by themselves, they're fine, but what happens is they get a bit blocked, and they become infected, and it can be a real surgical emergency as well too.
Yeah.
And there's as we get older, we describe it as a kind of gut wear and tear, and this is probably as a result of not having enough fibre in our.
I didn't actually realize that that was one of the causes of, or one of the symptoms of not having enough fiber is diverticulitis was.
I have my own theory as well too. Like we hear about the incident of kind of colorectal cancers and stuff like that becoming more prevalent in young populations, and you could think about like maybe the processed foods and that were, and all the carcinogens that we're kind of exposed to on a daily basis. My own theory is that I think because our gut transit isn't as quick as it maybe used to be, that you have all these carcinogens inside our gut, which are touching the lining of the gut for longer because it's going through less quickly, and there's greater chance that one of those is just going to cause the right damage to a cell, which is then going to start multiplying and become cancerous as well too. That's my own theory.
I didn't realize, obviously, some basic knowledge. I didn't realize fiber had such an impact on that whole journey.
Yeah, I think it just impacts so much of our kind of gut health. Yeah,
that is very interesting. How often should we be checking ourselves? I'm 37 years of age.
No way.
Yeah, I know. You think I'm in my 20s.
I know. Yeah.
How often do you think we should be checking ourselves? We can overdo it. We can underdo it. Again, what is it? What is a good balance? Yeah,
again, like broadly speaking, to the average person on the street, again, it's different for our high performance athletes, our people with actual health problems as well too. For me, I do it once a year as a bit of a health checkup. I'm on a little bit of a mission at the moment for men in particular to get their prostates checked up as well too, just on the back of like Chris Hoy and Eddie Jordan and all those these stories as well too. It's a simple test to get done. Well, there's two ways we do it. There's a physical, which puts a lot of men off, but it's
not. You want to put me on the spot here. I was like, hey, I'm not doing that here.
No, not on the camera. We didn't bring any lubrication. But it's a simple blood test which can be done, like a PSA blood test, and then I think it's useful just to get a kidney, a liver, a cholesterol, and a blood sugar check. And I think those are the sensible checks to be done on a yearly basis for generally healthy, men in their 30s and 40s. Women should probably undergo similar checks. Their prostates are absolutely fine. Yeah, that they will. I did a PSA recently on a woman by accident.
Oh God!
I was like, oh no. We just clicked. I was clicking down the list of bloods.
That is fine.
Yeah, thankfully it was normal. I was like, oh my goodness, if this is abnormal, how am I ever going to explain it? So I was like, oops. But they have their important checks to get done, in particular, kind of breast and pap smears as well too. And I think, for most people, getting it done on a yearly basis is sensible. Like if things crop up in the health checks, high cholesterol or something like that, we might need to do it slightly more intensively. But I think a once yearly kind of health check. Now, you can go completely overboard on the health checks as well too, and I don't think that is particularly good for you. Okay, not a big fan of these full body MRI scans and stuff like that, because we all have little lumps and bumps on our body, okay? And if you do a full body MRI scan, chances are you will find little cysts in your kidneys or your liver or something like that, which you would never have known about and will never cause you any problems.
Yeah.
But if you give this information to someone with a bit of health anxiety, then it can be really damaging to them as well too. So I think that the sensible kind of health screening, something that maybe didn't mention earlier on, is just about bowel cancer screening as well too. Okay, men and women. The company I work for recently did a free initiative for anyone above the age of 40 to get their poo tested, and it's a simple non-invasive test. It's called a FIT test, actually.
We won't align the brands in that one.
No. Kitchen, lab.
Yeah,
Keep them very, keep them
separate.
keep
for
them
now.
very
Yeah,
separate.
yeah.
But
I'll have to trademark it further.
it's a simple test. It's high 90s percent of sensitivity and specificity as well too. So it's a really good test to get done, and it was simple to do. Didn't quite think of the logistics of how to get the sample into the pot, but anyway, that was. But we did it, and thankfully it was negative as well too. So maybe that's another kind of screening test that should be done.
If you're guy once a year, get the bowel screening, the prostate done, and
then the metabolic markers. Your kidneys, your liver, cholesterol, blood sugar. Yeah,
perfect.
I think it's sensible.
You'll do that for us.
Yeah, no problem. Well, we were just chatting beforehand as well too. It would be really interesting to see the impact on the fit meals. Is to maybe do the bloods beforehand,
Absolutely.
and then do the fit meals for a few months, and then see what the results.
I'm up for it. I'll do it with you.
Yeah, let's give it a go.
You're just angling for a free.
No, definitely not. Yeah, of course.
No, we actually have had some people that have done that on their own initiative, and you do see the results. It's you can't. We don't scream about it on marketing because everyone is different, and it's not something you want to be. We can't promise change in anyone because our bodies are so individually different. But
it's and that is the thing. We all are different as well too. What I spend my day doing is trying to read the room, trying to read patients and their expectations and their kind of ideas behind what they want and how I can encourage them to make the healthy changes.
How you go back there saying I've definitely seen a big shift in people getting more checkups and getting tested and things like that, especially our generation compared to older generation. I think we'd be like, I'm not going into hospital unless I'm dying.
Yeah.
How do we make it even more accessible for people, do you think?
A few different ways, okay. Like in this area, there's a great amount of like lab tests which are available. You can get nurses out to your house to do these lab tests and stuff. I actually think they're good. Okay, I think they're good. However, it's all about the interpretation then of the results, and you could just put your results into ChatGPT, but it doesn't give you that human aspect. It doesn't read the slight look of anxiety in your eye. And I think that's where the human touch comes into things. To get that done. And I think my job as a doctor is to be welcoming, to break down the barriers, to break down that anxiety whenever you do come into the hospital. Which we all have, because I don't know, no one likes being there. Me in particular, I work there. I still have to be there, but that's my job, is to be welcoming, to have a chat, to read the verbal, the non-verbal cues that maybe you're giving me.
You mentioned something interesting there. You get a lot of patients doing ChatGPT diagnosis.
Oh yeah, it's huge. It's huge, and I like it. I actually do like it because people come into me with their ideas from ChatGPT, and it means that we can have like a sensible discussion around your kind of your thought process. Sometimes it's 100% right. A lot of the time it's not quite right as well too. It really, I don't think doctors are going to be replaced by ChatGPT anytime soon. I think it will always take that human touch, the communication skills, the reading, the non-verbals as well too. And you're only really as good as the information that you put into ChatGPT as well too. And I generally treat the patient and not the numbers as well too.
Everyone's different.
Everyone is different, and what might be slightly out of normal range on a lab test, that's my job then to interpret that and say, actually, that's not relevant for you, knowing your history, knowing your background. Yeah.
I think you've kind of covered it. We're nearly wrapping up, but if you could wave a magic wand and make people do one thing, it might be the checkup, might be that, and they would have to do it, what would that be?
One thing. Now, this comes from me, okay? This is my own personal belief. One simple thing that people could do: stop smoking. stop smoking.
Yeah. What about vaping?
Harm reduction. The jury's out on vapes at the
Yeah.
moment, but I think they have to be healthier for you than smoking. But most doctors will say that they're probably as harmful. I base my own beliefs that you're not getting all the tar, the
Yeah.
carbon monoxide, and everything like that. Ideally, no, you wouldn't vape at all. Okay,
Absolutely, yeah.
but if it was a choice between vaping and cigarettes, then I would say, if you have to do one,
Yeah.
to do the vaping. But really, if you can, cut it down
Yeah.
completely.
I think that's reasoned advice, it's not just saying you're wrong, get out
You
the
see,
door.
yeah, I can't be like that, doctor. Like I was looking up. Remember there was a food program called "You Are What You Eat."
Yeah, yeah, yeah,
and
yeah.
it Gillian McKeith, and she was very, very like quite hard line about a lot of things. You cannot do this, you cannot do that. I just, again, I think if I did do that, then it would start creating barriers between myself and the patient as well too. And if I'm, as a doctor, if I'm relatable and can chat to you,
Yeah,
make you feel
absolutely, yeah.
comfortable, then I'll work with you.
I get the impression you prefer the chat more than the job.
Yeah, well, yeah, I've a real interest in people,
Yeah.
and that's that's why I really enjoy my job as well too.
Is that hard as a doctor? Sometimes you're like, I'm really enjoying the chat here, but I have 10 patients outside.
I know. This is why I'm always running late. So sorry to all my patients as well too.
It is nice. I think people want the human touch with a doctor. There's nothing worse going into a very cold, clinical kind of a setting and a cold clinical person as well on top of it.
Yeah, definitely. Yeah, whenever medical things need to be done, we will always do them.
Absolutely,
as well too. But we can be humans and personable along the way.
Absolutely.
I think.
Perfect.
So
That is it for us. Thank you to Dr. Ed Cody for joining us on The Fit Life. You can find him at the Mediclinic Parkview Hospital. If today's chat reminded you to schedule that checkup, drink more water, simply just take a time out, then I hope it was definitely something worth doing. If we need to find out more about you, Ed, or Mediclinic Parkview, where do we go?
Thanks, Owen, for having me, firstly. And then, always can be booked via the app. I'm on LinkedIn. I'm on Instagram. I've got 3 followers now, so I'm doing really well.
4.
Yeah, 4.
After.
But no, thank you so much for having me to have a chat about, and hopefully there's been some useful information there for your followers.
Absolutely perfect. Don't forget to subscribe to us on Spotify, on Apple, or wherever you get your podcast. Thank you for tuning in to The Fit Life, and take care.